about psychopharmacology again. There's a lot of noise around me. I apologize if you can hear that. The medication I'll be reading about today is Lorazepam, commonly prescribed for anxiety disorders, anxiety associated with depressive symptoms, initial treatment of status. I cannot read that. Insomnia, muscle spasm, alcohol withdrawal psychosis, headaches, panic disorder, acute mania, acute psychosis, delirium, or catatonia. It's a bit darker and it might be a little harder for me to read. I apologize. How the drug works. It binds to benzodiazepine receptors at the GABA-A ligand-gated chloride channel complex. Enhances the inhibitory effects of GABA. Boosts chloride conductance through GABA-regulated channels. Inhibits neuronal activity, presumably in amygdala-centered fear circuits, to provide therapeutic benefits in anxiety disorders. Inhibitory actions in cerebral cortex may provide therapeutic benefit in seizure disorders. How long until it works? Some immediate relief with first dosing is common, but it can take several weeks for maximal therapeutic benefit with daily dosing. If it works, for short-term symptoms of anxiety, after a few weeks, discontinue use or use on an as-needed basis. For chronic anxiety disorders, the goal of treatment is complete remission of symptoms as well as prevention of future relapses. For chronic anxiety disorders, treatment most often reduces or even eliminates symptoms, but not a cure since symptoms can recur after medicine stopped. For long-term symptoms of anxiety, consider switching to an SSRI or SNRI for long-term maintenance. If long-term maintenance with the benzodiazepine is necessary, continue treatment for 6 months after symptoms resolve, and then taper dose slowly. If symptoms reemerge, consider treatment with an SSRI or SNRI, or consider restarting the benzodiazepine. Sometimes benzodiazepines have to be used in combination with SSRIs or SNRIs for best results. If it doesn't work, consider switching to another agent or adding an appropriate augmenting agent. Consider psychotherapy, especially cognitive behavioral psychotherapy. Consider presence of concomitant substance abuse. Consider presence of lorazepam abuse. Consider another diagnosis, such as a comorbid medical condition. Best augmenting combos for partial response or treatment resistance. Benzodiazepines are frequently used as augmenting agents for antipsychotics and mood stabilizers in the treatment of psychotic and bipolar disorders. Benzodiazepines are frequently used as augmenting agents for SSRIs and SNRIs in the treatment of anxiety disorders. Not generally rational to combine with other benzodiazepines. Caution if using as an anxiolytic concomitantly with other sedative hypnotics for sleep. Tests in patients with seizure disorders, concomitant medical illness, and or those with multiple concomitant long-term medications. Periodic liver tests and blood counts may be prudent. drug causes side effects. Same mechanism for side effects as for therapeutic effects, namely due to excessive actions at benzodiazepine receptors. Long-term adaptations in benzodiazepine receptors may explain the development of dependence, tolerance, and withdrawal. Side effects are generally immediate, but immediate side effects often disappear in time. Notable side effects include sedation, fatigue, depression, dizziness, ataxia, slurred speech, weakness, forgetfulness, confusion, hyperexcitability, nervousness, pain at injection sites, rare hallucinations,